Ready? Okay, perfect. So thanks for coming everyone to our traditional herbal medicine workshop. It's a collaboration between two of the diversity committees of the PAMSA, between the Southeast Asian Committee and South Asian Committee. And then today, like we're gonna just try to have like a quick overview on both like South Asian and South East Asian indigenous herbal medicines, and also have like a quick case study workshop about how to apply this to patient care in the Western healthcare system at the end. Um, I'll just go ahead and advance the slides, Dr. Shah, and then like just let me know when you want me to like move on. Oh my God. Okay, sorry. So first we have Dr. Shah, who's our speaker for Ayurvedic medicine. This is Dr. Shah's bio. So just as a quick introduction for her, Dr. Shah is a Ayurveda expert, and then she has pioneered initiatives in this field, and also this has brought her to attention at the White House, as well as some other departments in the U.S. And the Consulate General of India, New York City. For this work, she was nominated for some accolades, and later on, she began working as a CMO with the central government of India, and was featured in an international documentary as well, and spoke for the WHO Global Center for Traditional Medicine as a invitee. She's also the founder and president of the Wholistic Health Alliance Council for Ayurveda Research, and the CEO of My Ayurved LLC. And then she also launched her own high-end organic herbal product line as well, and practices currently in the greater Boston area, but has clientele like globally. So that's a quick introduction for Dr. Shah, and then now we'll just like move into her portion about South Asian medicine.
So thank you for inviting me. I'm delighted to, first of all, be on a platform with young emerging medical professionals, and I'm really happy to see the interest in learning about what other ways of health and healing are out there. So thank you for having that healthy attitude and open mind. I really appreciate it. And I'm an Asian, I'm an Indian, so I'm glad to be on a Pan-Asian platform. I will do a very quick Ayurveda 101 introduction with all of you today, because this is, I'm sure it's a little alien to all of you. Maybe you have some idea about it or introduction about it, or maybe you don't. So I have kept my slides today very, very simple and very, very basic and introductory, considering the limited time that we have. So next slide, please. So this is just a disclaimer that whatever I'm sharing today is meant for educational purposes only. This is not a prescription or replacement for your medical advice. Thank you. Next slide, please. So the questions that may come to your mind at this time: why talk about such an ancient system in 21st century? This is so old and, archaic. What value can it have? But actually, a system like Ayurveda that has stood the test of time and that is now beginning to provide very contemporary health solutions in today's age and today's challenges stricken healthcare system. It is actually much more relevant today than it was probably in the ancient times. So I'll try and set the context for that. And I'll talk about some of the issues and challenges with the current healthcare system. And then if you are looking outside of the mainstream healthcare system, there are so many choices. How do you pick one? What do you choose? What is relevant? So I'll talk about why Ayurveda, and then what is Ayurveda, in whatever limited time. So next slide. So this is a recent study that has shown that only 7% of Americans are satisfied with the current healthcare system. The desire for change crosses political boundaries. So 6 out of 10 people from multiple political affiliations agree the healthcare system needs a change or a complete overhaul. And according to a Gallup poll, 7 in 10 think the current healthcare system is in a state of crisis or having major issues, with similar sentiments expressed for almost last 30 years. So I think everyone will agree it's probably time for a change and look at things differently with different sets of eyes. Next slide, please. There must be a reason why this is happening. So this is another fact that has come out from a study by the Commonwealth Fund, that the United States trails far behind other similar comparable high-income countries, whether in Europe or Northern America, on measures of healthcare affordability, administrative efficiency, equity, and outcomes. Next slide, please. So you can see some, okay, so the conclusion of the study pointed out to 4 features that distinguish top performing countries from the United States. First one is they, the other comparable nations, they provide universal coverage and remove cost barriers, which is, you can understand it's a major access issue. If you don't have access, you cannot utilize the healthcare benefits. Second, most important, they invest in primary care systems. This is what I would like to underscore and highlight, because this is the differentiator under which Ayurveda really fits very well, because Ayurveda is the mother of primary preventative care, primary prevention, not secondary prevention. What we have in today's healthcare system, it's mostly secondary prevention, because you're talking about screening. And when you're talking about screening, you're talking about diseases that have already developed. So that's not primary prevention. So Ayurveda brings so many guidelines and solutions and tools for primary preventative way of living, which I won't be able to cover today, but I wanted to underscore this one. And then the other countries, they reduce the administrative burdens that divert time, efforts, all these insurance business and claims and whatnot, those kind of administrative activities that take away from the client and their needs. And lastly, they invest in social services, especially for children and working age adults. Next slide, please. So next few slides are just numbers. You can see the overall ranking, the top row, you can see the last column is United States at number 11, which is the lowest among other comparable nations, Nordic countries and others. Next slide. Here also you see US is at the very bottom in terms of comparison between performance scores of the healthcare systems. Next slide. And here you can see the healthcare spending, which is in US, it was 18% of its GDP. This is 2019, but later on it was at 18%, might be more even now at this time. So US is spending more than any other comparable nation with worst outcomes. So something is really wrong here and some things need to change. Next slide. And these are all the systems that you see online when you start looking for what else is out there, other than the mainstream healthcare, what else, what kind of other systems are providing some kind of wellness support or healthcare solutions. And you can see there's a long list. Next slide. So why choose Ayurveda? You can go ahead, click enter. So it's knowledge accumulated over centuries. A science that has stood the test of time. And when I say knowledge accumulated over centuries, basically it is observational data that was accumulated, analyzed, and then converted into tested protocols. So it's important to acknowledge that and maybe pay attention to some of the solutions that Ayurveda provides. And this is a science that has stood the test of time. Next. Again, as I was saying earlier, huge focus on primary prevention, self-care practices, guidelines for various phases of life. When you're young, it's different. When you're an adult, it's different. When you're old, so all geriatric solutions are there. In fact, one of the 8 branches of Ayurveda, geriatrics is one of them, gerontology. And for women, right from menarche, how, what kind of foods and self-care, and then in motherhood, and then postpartum, and then menopause. So all stages, different guidelines, dietary recommendations, lifestyle recommendations are there, herb recommendations are there. Then we have in Ayurveda the intervention, medicinal intervention. There are other interventions. Yoga is part of Ayurveda. Yoga is the younger sister science of Ayurveda. So that's a non-herbal intervention. Meditation, breath work, body work, those are all non-herbal. But herbs are the kind of medicinal part, and herbs versus drugs, you can understand that herbs are whole plants and they're natural. They are not isolated chemicals, so their acceptance in the body is very different as compared to the chemical drugs. Whole herbs, and again, time tested, very classical, like traditional Chinese medicine, and a lot of herbs that have been mentioned, herbs and spices that have been mentioned in Ayurveda are now being studied, and um, they are being found to have those kinds of therapeutic properties, medicinal properties, as have been mentioned about 5,000 years ago in the classics. Like, I'll just name some of the popular ones. So among the spices, of course, turmeric is at the top. But we also have ginger, we have cumin, we have fennel, there are holy basil. Then we have in medicinal herbs, ashwagandha. I'm sure everybody has heard of ashwagandha. It's the Indian ginseng, you can say. It's a single herb, and there are many like that that have been, in for neurological well-being, for overall well-being, for immunity, immune modulators. So stress modulators, variety of herbs have been studied, available on PubMed, and are being studied. So that's a growing body. Next, please. This is a very, very important differentiator. In Ayurveda, the approach, first of all, the focus is on the person, not the disease. Roga. Roga is disease, Rogi is person. So Rogi is the focus. The person is always the focus, the disease is not, and therefore the person remains at the center of care. The disease does not overpower the person. In Western medicine, the focus is the disease, not the person, right? If it is heart numbers that are out of range, the cardiologist is going to focus on the heart problems and wanting to bring the numbers within the range. In the process of the kidneys are getting impacted, they're just going to refer out to a urologist, right? So the focus remains on the disease in Western medicine. Similarly, if there's an infection, drugs are given for the infecting agent without regard to what impact it's going to have on the person. I mean, what we need is an integrative approach. If there is something severe, acute, life-threatening, of course, we should use maybe drugs to stabilize, but for everything else, which is the main burden of healthcare, it should be non-Western approaches. And Ayurveda is a strong one for that. Next one. I actually wanted to cover that targets root cause. So root cause analysis is extremely important in Ayurveda. I kind of specialize in autoimmune diseases in addition to all of the other types of illnesses. But so for example, in let's say SLE, which is a autoimmune disease, the standard of care treatment is steroids and something like Plaquenil or something like that. Whereas my effort is to try and analyze where is it coming from. Is it coming from gut? I mean, most of the illnesses are gut rooted, but is it primarily coming from some trauma, so the emotional side, or something else? And I'm able to kind of put the dots together, being a medical detective kind of, and put the whole picture together and get to the root cause. And then the, outcomes are very successful, and prognosis improves, and the progression is stopped, the condition improves, and there is more likelihood of remission and continued remission rather than flare-ups. So that is something I have seen in my practice when I was in India with the government of India, 13 years, and here where I'm not not able to use the title of doctor, but I work in the wellness sector, sort of. So, but these are the cases that get disappointed or um, frustrated with mainstream care where there is no lasting solution, just band-aids where, they're just able to barely get by, but things continue to get worse. And then another very important differentiator is capacity building. So we have the concept of tonics in Ayurveda, where different herbs are able to do capacity building or capacity enhancement of particular organs or glands or systems. So we have lung tonics, for example, or liver tonics or heart tonics. So for example, if there is any myocardial injury, there is a plant and you can write down the name Arjun, Arjun, and you can look it up. I think there are good studies on PubMed, but even if you do a Google search, you'll find it's a large tree and the bark is used generally, and that helps to heal the inflammation, the injury to the cardiac muscles. So that's what I mean by capacity building. So that's an amazing concept, which, for neurological capacity building, you can imagine, nootropic herbs and formulations that help with neurological health. Plus, it's like if you're at X, you can help your health reach X plus, like that. Especially, this is even more significant if someone has family history of heart illnesses, then they can proactively start using Arjun, for example, like that. Think about how much application this can have. Next, please. Heals, manages illnesses in a holistic manner. What that means is that without causing distress at a cellular level or to another system. So that is what I mean by holistic, and always keeps the body, mind, spirit in mind, because we don't just see a person as a mere physical body, but a composite of their emotional entity, their physical entity, their physiological entity. Next, please. So this is the mother of personalized medicine and specialized therapies. So you will see, I have a few slides on that. Next, please. So comprehensive care, to summarize, mind, body, spirit, and it's like a life compendium. Next slide. So what is Ayurveda? Now I'm going to talk about that. Next slide. Ayurveda is a Sanskrit word, and it is actually a complex Sanskrit word, means it is made up of two individual Sanskrit words, Ayu and Veda. Ayu means life, Veda means knowledge of. So basically, it's a stream that has knowledge around life. How do you live life? What are some of the things to live life by? What are some of the guidelines for living life? And it's a common sense science. I'll see if I can explain that a little bit in today's talk, but it's a common sense science. Maybe I can give you one quick example. So, for example, if it is winter outside, common sense is you should be having warming foods and beverages at this time. So you can understand what I'm trying to say. If you're having cold smoothies, raw smoothies in this weather, there's a problem. So we have kind of disconnected from, you know, our connection. Now, circadian rhythm is being highlighted a lot, and that is a huge concept in Ayurveda. But maybe at some point we'll also talk about seasonal rhythms, not just circadian rhythms, because seasonal rhythms also matter and they impact our metabolic capacities, our processing, assimilation, everything. And if we are not eating somewhat aligned to that, it does create some problems. Or another example of common sense is our own gut is like our personal burner. And let's say you're about to cook food on the burner, on the gas or whatever stove, and you're pouring iced water just at the time when you're needing to cook. So the iced water practice that you see in restaurants or, around you is problematic. At the time of eating, how can iced water make any sense? Obviously, you're going to have digestion issues. All right. So just small examples. Next slide. So Ayurveda is like the user manual of life. You pick up the user manual, you find out what is my model, what are my model's strengths, what are my model's not so strong points, what are my model's unique maintenance requirements, and then you operate yourself, right? Because you can still use, like, if let's say you pick up any gadgets or appliances that are around us, we do that for everything around us, right? Even if we buy a vehicle, we first pick up the user manual. But when it comes to us, we are not thinking like that, unfortunately. It's like, what is everybody else doing? What is popular, what is trending? Whatever is trending might be trending, but it might not be suitable for you, might not be the right thing or aligned thing for you. So basically, this is a good time to reflect upon us also being unique as individuals, and we having a unique model, and this unique model has certain unique strengths but also some weak areas, and it's important to know your model so that you can operate it better, you can maintain it better, you can take care of it better, and bring about longevity and efficiency of the model, right? So again, basic common sense here. Next slide. The 3 P's of Ayurveda: personalization. Again, I've talked about the concept of body typing, and I'll expand on that part a little bit in the next few slides. Promotion. This is the positive health I was talking about. If you have X amount of health, there are ways and protocols and methods to make it X plus 2 or X plus 3, or you can enhance positive health. Prevention. This is the big part, which obviously cannot be covered today. But these are the 3 P's of Ayurveda, if I were to give like a very, very short elevator pitch about it. Next slide. So in the prevention, we have all of these, which I won't be able to expand, but daily self-care, this is huge. Ritucharya, seasonal care, food and lifestyle as per body type, hormonal harmony, mental well-being, care in transitional phases of life, age-related protocols, healthy progeny guidelines, periodic structured deep tissue detox, and more. Next slide. Promotion, again, as I said, it's the plus. So concept of tonics, eye, liver, heart, brain, skin, bodywork therapies. How do you maintain your joints, your lubrication, everything that you have in your body as a physical system, as a physiological system, as a psychological system? How do you maintain that and do the plus health protocols, anti-aging solutions? Next slide. So the part I'm going to expand on a little bit is the personalization part, that all of us are unique. Next slide. The basic central concept here that helps to understand personalization is that we are all made up of 5 fundamental elements. Now, this may seem a little abstract, but remember that metaphysics and physics go hand in hand. So this is the metaphysical side of things, where you're doing some kind of concept establishment to structure more understandable methods and protocols thereafter. So this is the very central concept in Ayurveda, that all of us, me, the trees, the soil, the animals, everything is made up of 5 elements. And so I'll name those elements. Earth, which is, you don't have to worry about the Sanskrit name. Earth, water, fire, air. Ether is nothing but empty space. So my son is a physicist, and long ago he had told me 80% of any atom is space. Actually, that's a fact. So space is a very important element. And you can all imagine that in our lives, we have too much density these days. Earth is too much and space is less. So, but anyways, these are the 5 elements that form all of us. And this is a beautiful concept because that allows a common denominator between us and the outside world. And this in itself is very important and beautiful, because in the 21st century and progressively so, we are becoming isolated from whatever is around us. It's like we can survive without the rest of the living entities on the earth. There's too much of that is coming in, and we are cocooned. We are inside a closed space and we think nothing outside is going to affect us. But that's not true. So this concept also allows you to kind of, from here, it allows you to expand your approach, perception towards the rest of the world, towards life itself, that we are all interconnected. Okay? These 5-element theory or concept or hypothesis allows us that perspective. It's an important perspective. We are not living in isolation, and that would be, a mistake to think that we can remain completely disconnected from whatever is happening in the environment or in the rest of the biome around us. So this is a very central concept. Now, next slide. So the idea is that, can we go back to the previous slide? The idea is that these 5 elements are represented in our body in the form of 3 functional entities. Then they have a name. Vata is air, ether. Pitta is fire, water, and Kapha is earth, water. So the very simple takeaway from this slide is that when we are born, we have a certain unique elemental composition. Okay. And depending on which elements are dominant in our body, we all know we are unique from the concept of DNA. Think of this as an elemental DNA. Okay. So your elemental DNA footprint is unique. Okay. So let's say somebody is earth, water dominant. Now, earth is a bulk material element, right? Earth is material. And water is binding. So earth and water dominant people are material abundant. They are large people, wide shoulders, big bones, big joints. Whereas air, ether, air space dominant people will be skeleton, skin, and minimum material, right? So skinny, bony, petite, right? That is the physical body. And whatever the elements you're dominant in, you're going to exhibit their qualities. So earth, water are cool. So these are cool people, laid back. Whatever is happening, no problem. Don't get impacted easily. Fire people are like fire. They will let you know they are fire dominant. You will feel the fire in them. Air, ether will be like air, ether, light, ungrounded, fidgety, agitated, easily anxious, worried, but also very creative, right? Next slide. So Vata is air, ether, and air, ether people are, you can see, thin, fast, quick thinking, change very fast. Everything that moves in the body comes under the Vata umbrella. This is where actual practical application of the metaphysical concept starts to happen. Next slide. Fire, you can see, to do anything that transforms in the body. And fire people look like fire, means reddish, shiny, bright, defined features, clear jawline. They can represent fire temperament, so fire is something that will reflect in their, mental qualities and their behavior as well. Next slide. And I've kept it very short. These are like long a list of qualities and features that are listed in the classics. Earth, water people are large and, stable, just like earth, like a mountain. Think about a mountain. Very stable, firm, strong, but also sedentary in their habits because earth keeps them like that. Next slide. So these are some of the tendencies, because air, ether will tend to cause drying, and the drying, whether it's on the skin or in the colons, constipation, or the joints, arthritis, anxiety. Fire people, blood diseases, so any bleeding disorders, inflammation, heartburn, ulcers, hypertension. Kapha will be sedentary, more leaning towards sedentary habits, related health issues, weight gain, diabetes, congestion, sinusitis, etc. These are lower threshold for these body types, blueprints. Next slide. So next, keep pressing. So this is again just a repetition of the earlier slide. So I will not go over it, but I just wanted to reiterate it here. Next slide. Yeah, so I think I finished on time, 30 minutes precise. If there are any questions, I'm happy to take them.
Thank you, Dr. Shah. I think it was really valuable to like hear like about how personalized this type of medicine can be, and also like just like the reasoning and that like it's such like a long-standing traditional type of medicine that like I don't like that like people like are still using it to this day. So it's like really good to like bring awareness to this type of like practices that you might see like patients and other people just like using.
Thank you.
Okay, if no one has questions, then we'll move on to the Southeast Asian medicine portion. We'll be having Sandra speak. I don't know if you want to introduce yourself quickly, Sandra.
Yeah. Hey everyone, I'm Sandra. I am a third year medical student at Touro College of Osteopathic Medicine. Before that, I actually trained as a full spectrum doula, supporting in the full spectrum of reproductive health care in terms of labor, pregnancy, miscarriage, elective abortions, and all that stuff. I trained in that originally in New York City, and I felt like something was missing, and I felt like doula work really just touches upon a lot of traditional medicine, but they never acknowledged it because this is doula training in a Western context. So I actually ended up going to Thailand and learning under a traditional Thai medicine doctor. And I'm in no means an expert, but I just wanted to come and share my experience with that and how you can incorporate traditional and indigenous medicines in your practice as future doctors. And before I start, I also just wanted to acknowledge that before I start talking about my own indigenous medicine, also acknowledging I'm paying homage to the Lenape lands that I have been raised and grown up on, also known as New York City, and also to acknowledge the indigenous resistance going on right now in Gaza against settler occupation. We can't talk about indigenous medicines without acknowledging indigenous people and our resistance to colonization. So just wanted to put that out there. And then you can just go on to the next one. So a lot of the medicines that messages that are on here are actually really similar to what Dr. Shah was talking about. So I'll go over this a little bit quickly so I can show you some examples. But what is traditional Thai medicine? It's very similar to Ayurvedic. I think our medicine has branched off of Ayurvedic and started incorporating other pieces of traditional Thai medicines as well from different ethnicities. Southeast Asia is one of the most diverse ethnicity and ethnically regions in the entire world. And as many as you know, nationality is not the same as ethnicity. So while I say I'm Thai, I'm actually also Mon, which is an indigenous group, not recognized by the government of Thailand, but we're still here. And also I'm Teju, which is an ethnically Chinese indigenous group in Thailand as well. So then here, the most important parts, I think, of this workshop I would love for my fellow classmates to take away is people always ask, like, why would you even invest in traditional medicine when we know Western medicine or allopathic medicine works, when we know there's more research on it? And I think that is a really good question, but also a misunderstanding of what traditional medicine is. Traditional medicine is really a whole philosophy. It's a whole culture. It's not just the herbs that we pick or the herbs that we use. It's very much ingrained in everyday life and how we actually view our own health. So a lot about traditional medicine is focusing on maintaining wellness. So it's also known as preventative health here. But it's really more than that because every day you are incorporating pieces of maintaining wellness and maintaining health. So it's not really like, oh, I'm preventing diabetes. It's more, I'm taking care of myself, and it encompasses like preventing diabetes. It also promotes self-reliance and intergenerational involvement. I think if any of you have grown up with multiple generations, it's like unheard of that your family would go to the doctor without you because everyone in the family is involved with everyone's health in the family. And it also, a lot of traditional medicine emphasizes your own role in preventing your health, whereas here, I think we're getting better, but we do have a paternalistic attitude in Western medicines of don't don't Google it, don't even go on WebMD, like stop asking me questions. I'll tell you what to do. You take these drugs and then you go home. We're getting better at it, but I think that's something that's like very, very unheard of and very against traditional medicine environments in most places, I think, besides the U.S. The best thing I think about that I learned when I was in Thailand is that traditional medicine really coexists with allopathic medicine. So a lot of times, medicines that are traditional are coinciding and coexisting with other practices. So it's very unheard of to have someone only do one sort of medicine, unless there is some sort of barrier, which is, there's no hospitals in the area, there's no access to medical doctors. But I would say most of a country will really bridge the two, and a lot of a lot of traditional doctors promote um, will also promote uh, like allopathic medicine. So in terms of, okay, this is what the herbs can do, but if you have this and this needs surgery, and that's not something I can do. And another thing that's really important about traditional medicine is that there's a lot of cultural importance, especially post basically every war in Southeast Asia. There was a lot of us. A lot of us were colonized. A lot of us suffered a lot of violence in the entire Southeast Asian region in the 1970s, 1960s, 1970s. And a lot of countries actually started promoting traditional medicines after that. It's a form of cultural resilience. Next slide, please. So I'll go a little bit into this. So indigenous medicine, what actually makes it different is that it preserves culture and spirit. So it's very hurtful and very painful for an allopathic doctor to say, I don't want you to do this and this, just because I don't understand it, or maybe it doesn't do anything. When this medicine goes really far back, it goes far back with generations. It focuses on relationship with the land, air, and people, with your family members. For example, like I put my teacher there actually, so she's on the top. So the plants that we collected on that during our lessons, her like great grandparents like built, they planted those trees. So there's a lot of importance and meaning that comes from the medicines that we use that goes beyond just whatever it is for the wellness purposes. And I put some examples of other indigenous medicines there. So we have the rebozo, which I think the bottom right woman is using to carry her baby. So it might just look like a piece of cloth to us, but it's such an important tradition for indigenous Mexican cultures to use this birthing scarf, also used in a lot of other indigenous practices and womb healing or womb sealing. So we may look at it as one thing, but in reality, it's so much more than that. And if you want to go to the next one. Okay, so here's some pictures. I just wanted to share a little bit about the actual indigenous medicines that I was practicing. So I did my training in traditional Thai massage, also known as Nuot Boran, and also womb lifting, which is called Yok Mok Loob. So these are traditional practices that have been going on forever, that are aimed towards the healing of a person's womb after postpartum. So during postpartum. So in a lot of Asian cultures and a lot of cultures everywhere, they usually do some sort of term like confinement after birth. I heard that there's 30 days, 40 days. In Thailand, we do 40. So during this time, it's really important to preserve certain elements, kind of like what Dr. Shah was saying about the elements of fire. So they say that when you have given birth, you actually lose a lot of that fire in creating and giving life. So you're spending the next 40 days really gathering that stuff back. So a lot of it is about steaming, a lot of warming herbs. So you have me like in a little cocoon on the left side. So that's vaginal steaming. So that was a really interesting process. First preparing the herbs for it. It felt like I was making a stew, but it was actually just for like the lower regions. And that was really special because so much care goes into just picking the herbs. I think getting herbs in America is so devoid of spirituality and actual healing because you don't actually feel how how these plants have grown. You don't actually put a lot of labor into it. Someone else has done that for you. So I think that's a really special part of it. And also like washing, preparing it, you're really putting a lot of intention into the medicines that you're doing. So it's not just like I'm shoving it in a sink and I'm just like washing it or something. It's very intentional. And I put in on the bottom, it's herbal compresses. So you can actually buy these online, and a lot of people actually sell them. And what I didn't know is that when people sell them, they put it in this yellow bag, which often represents like Thai stuff. We just dye everything this color. And what I didn't know is actually it's a natural color from zingiber, which is a very important herb in Thai culture and Thai healing. And it naturally dyes the bag for you once you steam it. So a lot of our monk robes are actually this color. So they're dyed that now, but in the olden days, it's because of the herb that was used. I'm collecting the tree, leaves from a tree that I was telling you that was like a great grandparent. So it was like very special to ask permission to take the stuff from the tree and also, I guess, like pay homage to the land that you are collecting this stuff from. And then on the top is also another form of steaming, kind of like smoking. So that one's really cool. Okay, next slide, please. And I think what a lot of people don't understand is that traditional medicine has so much actual medicine in it, like allopathic medicine in it. There was a lot of anatomy lessons that I really thought I escaped when I went to this class. A lot of focus on things that we actually don't even learn about in allopathic medicine, which is the resilience and laxity of tendons and ligaments, and fascia. Fascia connections super important. I know that in allopathic medicine we know that it exists, but we don't really understand the relationship it has with our organs or with our muscles. So a lot of the classes that I took was about supporting those tendons, ligaments, and fascial connections to our organs, mainly the uterus, which you know is very muscular and very supported by those four ligaments. Maybe we can go to the next one. And then I just wanted to show an example. So this is a hospital in Bangkok where it's a TCM, the traditional Chinese medicine hospital. It's about 10 floors. It's huge. This is the biggest picture is the pharmacy. And a lot of the doctors, the traditional Chinese medicine doctors there, they work hand in hand with a hospital that's down the block as well. So they'll say like, oh, this is like not good. Like go there if like something needs to be dealt with allopathically. But it's like very integrated, and people often go to both. They don't just go to one. And I feel like in this hospital, it's very focused on wellness. So in the bottom picture, you'll see there's a lot of posters. It's posters that are describing classes and workshops that they hold for the community. So they all come, and it's a bunch of like really old Chinese ladies. This is in Chinatown in Bangkok. Really old like Chinese ladies who come in, and they just like take these classes every day and then learn about different herbal support. So I thought that was really cool, and I hope that maybe one day we can have something like this in the US. And I think that is it from my end. Do you guys have any questions? Okay, thank you.
Thank you, Sandra. I think it's like really valuable to hear like again like about like you were saying about like indigenous medicine and things. I think it's really interesting to think about it as a form of like cultural preservation and things like that, because sometimes people just like kind of really like just look at the scientific side of medicine, but there is an aspect of like healing, like that's how like patients will think about it on their own end. Just like as a segue, I kind of wanted to talk about like my own experience as a patient of herbal medicine before we go into like the patient case and the workshop portion that I kind of wanted to do. So I come from like a Vietnamese background, and something that I really wanted to emphasize about traditional medicine and herbalism is that a big part of it is like accessibility, especially for people of like backgrounds where they're not able to go to the doctor, or like they don't have like higher education sometimes. Things like cupping or like herbal remedies or steam therapies are things that can just be passed down through families over time, and that makes it more accessible for people so that they can rely on these methods when they want to kind of improve their own health. Um, so I guess like from my experience as a patient using herbal medicine is that during COVID in the Vietnamese community, it was really popular to use like the herbal steam therapy, which is like something that Sandra mentioned before, actually. So then like I actually did this myself with my entire family when I had COVID. It's called Sam Hai, which is like just means it just means like kind of like breathing in steam. So you would just like collect like these herbs that have like a significant meaning. They're meant to like kind of improve certain kind of like auras within your body, and it's just very selective. So you could have things like ginger or lemongrass, things like that, and then you would just boil it for a really long time until it has like a very strong smell and there's a lot of steam. And then you sit under a blanket and then just have like the pot there with you, and you kind of just like inhale the steam. So the reason why I wanted to bring up like herbal steam therapy specifically was that during COVID, it was just like an accessible way for people to kind of like relieve their symptoms and kind of like comfort themselves like holistically, especially because during COVID there was like a big concern because at first like there was like really, you know, like no medications or vaccines and things like that. So that's how I kind of see like the importance of herbal medicine, especially for patients who, you know, aren't really able to access healthcare reliably sometimes. So I'm just going to segue now into our case study really quickly. So I'm just going to read out the main points from this. But in this case, we have a patient who's being cared for by her husband, and she has symptoms of confusion and erratic behavior as consequences of somatic causes. And then they believe it's because of her pain from the Western medication that she is taking, and they believe it's because it's too strong for her. So because of that, this patient has turned to Eastern medication, and they believe that the Western medicine that she is taking is causing these somatic symptoms like heat and discomfort and changes in her temperament. So then, but they seem to see like some type of relief with traditional medication, for example, herbs and acupuncture. So I just have some relevant questions for this case study. So I kind of want to discuss like what are possible strategies for increasing adherence to medications in this woman. So I think the main issue for this patient is that she seems to be experiencing these kind of like negative side effects from their Western medicine, and then they perceive that as kind of like an inconvenience. So does anyone have suggestions for how they think that adherence could be increased for this patient?
I guess one thing to make sure of is that the patient is receiving these instructions and all the information in, ideally in a language that she's most comfortable with. Patients can hear that this medicine will cause them pain and side effects in English, or maybe they'll hear all these different side effects and boil it down to certain things and not fully realize the implications of what taking this medicine will do to them. So just making sure that they're coming to her from a standpoint where she's most comfortable with.
Yeah, I think that's like the main point of like, and that's like a really important point that we should make about communication. There could just be that like she doesn't really understand the causes or like did not expect the side effects of these medications if it wasn't communicated to her previously. So like that, just like clear communication, and then like letting the patient know like, oh, like you can expect this if you take these medications, or like if this happens to you, it could resolve like over time, things like that. Just being clear with the patient about like what to expect and what they can do to relieve the symptoms or side effects that they have with the medication can really help the patient, I feel like, at least know what to expect and then know how to deal with what they're doing, and that could increase adherence to their treatment. Okay. And then for the next question, I just wanted to talk about how a doctor should react if a patient tells them that they are receiving help from a spirit medium or they've also been taking herbal remedies. How do you guys think that a healthcare provider should respond to a patient speaking about their alternative treatments?
I think one of the things that we could do is ask them what are the preparations that they have. So just like when you have other patients come in and they tell you they're on a bunch of medications and they tell you that they don't know which ones they're on, you would say, oh, okay, next time you come in, can you bring the medications that you take? Or can you have your caretaker, your daughter, your son, or anyone come with you? And then that would be something that they could do as well with herbal remedies.
Yeah, I think the important thing that like as future physicians that we always want to make sure is that we're respectful of the patient, but also watching out for their health. So then I think it's like important to acknowledge that, you know, these patients like are like could be potentially relying on alternative medical treatments. So then we need to make sure like we accurately like ask them and then are able to record everything that they're using so we can, you know, like monitor how they affect their health or like potential drug interactions and things like that. So I think like as a healthcare provider, it's good to, you know, like acknowledge that patients are like potentially using these, ask them to kind of provide us the information so then we can, you know, like really help them make the best clinical decisions for themselves. And I think like another important point to that is that if a patient tells you that they're using these alternative treatments, you know, like we should kind of like do some research on our own and then see, you know, like has this kind of herbal remedy been shown or like under research to have like some type of interaction or to have some negative effect because we always want to make sure that patients aren't doing anything that actively harms themselves at the same time. So I think it's just like a balance of like making sure that like, you know, you respect that the patient is like using these alternative treatments to kind of like help them with their own holistic healing, but you also want to make sure that nothing dangerous is going on. Okay. I think that was all the questions that I had for my case study. So thank you everyone for coming. Does anyone have any questions or remarks that they want to make?
Thanks, Anne.
Thank you everyone for coming.
Thank you, everyone.